Good afternoon and welcome to the latest in our series of live career webinars brought to you by the HOP platform. That's the Hertfordshire Opportunities Portal, and something that we hope that all of you who are students and attending schools and colleges in Hertfordshire will become very, very familiar with. So on your screen at the moment, you should be able to see the details of the website and also our social media channels as well. Use HOP for a resource guide to any careers that you want to find out about within Hertfordshire and on a national level. We think it's a really good website and we hope that you're familiar with it within your schools. Now, the purpose of this webinar today is to give you the opportunity to hear directly from somebody who's doing a job or is a part of an industry that you are interested in. And today we are looking at careers in dentistry. So firstly, for those of you that are watching this session live, well done for giving up your time once you come home from school, investing time into come and watching this webinar live. Now, really hope that you make the most of this opportunity, because by attending this session live, you've got the opportunity to ask questions and interact directly with our panel. So our panel today consists of Una Monaghan, who is well, in fact, I'm going to get her to describe her title for us. Before I do that, though, let me just let you know, those of you that are watching this live at the moment, we can't see or hear any of you, so you are completely anonymous. But you can interact with us by asking questions. And the way that you do that is via a text. And you do that by clicking on the questions tab on your dashboard in front of you. That will present a text box, and in there you can type your question in. It'll only be visible to me, and then I can ask Una that question on your behalf. So if there's anything that you think of that you really want to know a little bit more of, please use this opportunity to ask Una any questions that you like. So good afternoon, Una. Thanks so much for joining us today. Could you give us a little bit of background about yourself, first of all, please?
Yeah, of course. So I am a dentist. I'm also the clinical director of the special care dental service in Hertfordshire. So we are a service that take care of people who couldn't access a high street or family dentist. So that might be people who are very poorly, or people with learning disabilities, or people with very poor mental health. And they come and see us. And so we're a little bit different than maybe the dentist that you go to yourself, who will be possibly a high street dentist and hopefully somebody you've known all your life, and you have a very good relationship often with that family dentist. So my background was exactly that. I worked as a family dentist for very many years before I decided to go into working in this very specialist area. And I am part of what is called Hertfordshire Community Trust, and that is one of the trusts that run NHS services in Hertfordshire. And as the clue is in the title, we are a community trust, so we do all of the work that links in with communities, and we deal with a lot of people who are really quite poorly and have long-term needs, so maybe illnesses that go on for years and years and years. And we're very much sit within that trust, and I do a lot of work within the trust and supported by other medical colleagues within the trust to develop services for people with learning disabilities and things like that as well. So I say all that because dentistry, when you are young, can seem very much like it is sitting in the high street dentist that you probably go to for your checkups, but it's a broader field than that, and I hope today we can explore that a little bit so you can see some of the different areas that that dentistry can lead into.
Okay, now thanks very much, Una, and yes, we'll explore that in a little bit more detail. But I think as you said here, I think what most people associate as a career in dentistry probably is the dentist that they've been going to from a young age. So whilst we will talk about that, and of course you've got your experiences having done that, it's a really good opportunity to explore the different branches of dentistry which exist that I suspect lots of people watching this won't actually know about. So what we hope we will do over the next 45 minutes or so is to present the wider umbrella of dentistry and to provide you with information about the different strands that you can go into. We're going to talk about how you get into dentistry, so what courses, which degrees you might want to do, which subjects might be useful for you to do to access those, and then we'll think about the prospects for dentistry as well. But a bit of spoiler alert, we do know that there will be plenty of need for dentists in the future. So if this is a career you're picking, you're going to be picking a fairly secure one where there's going to be plenty of demand for in the future. What I'd like to do first of all is talk a little bit around about what a dentist does. Now that sounds pretty obvious, because I said everyone's had exposure and probably has had a relationship with their local dentist for a while. But could you just explain to us, Una, the different strands of dentistry? You've spoken about the special care provision that you're involved in now, but what are the other strands that someone might go into?
Okay, so most people do go into being a high street family dentist, and that is a very exciting career choice. A lot of people will go in to do a degree in dentistry because they know that's where they want to go, and they like the idea of running their own business. It is very business orientated because you are actually running that practice, usually with support from a manager. But that aspect of it gives it a little bit of an edge compared to other medical careers where you would probably be salaried within the NHS. It's very different when you're a family dentist, and that's the majority of dentists do go down that road. And then sometimes people work in the NHS, and sometimes people work privately, so they will discuss costs with their patients depending on the need. And everybody most people do a mixture of both, but some people just go completely private. So there are lots of sort of different strands within that. And then the work that people do, again, I mention this because I was telling Gareth this when we were chatting beforehand. I went into dentistry really not thinking that I was going to have to make dentures. And I can remember age 19 going in to do my first sort of practical session, thinking I was going to be drilling teeth and doing fillings and learning how to do impressions for dentures, and thinking I have to do dentures. So I'm just going to mention some of the things because you might not have come across them. We do a lot of fillings and things, and we do a lot of cosmetic work as well to try and make mouths look nice and healthy. We do a lot of extractions where we're taking teeth out, and that might be for orthodontic reasons or because a tooth really needs to go in the bin. It's well past its sell-by date. And we will also do things where very complicated things like root treatments, which are like a filling that you put inside the root. And sometimes as well, I've mentioned orthodontics, we will do things to try and straighten teeth as well. So there's a lot to do. The other thing I would stress as well, and this is across the board, dentistry really suits you if you're someone that likes working with your hands. It's incredibly hands-on. It is surgery. We're dental surgeons, but we're working in a really confined area, very personal area for somebody inside their mouth. People are often very anxious in that situation, so you need to be good with your hands. You need to be able to come in and do really fine detailed work in that way. The other strands that people do go into, a big one is oral surgery. So that's based very much in the hospital, and oral surgeons will often do a degree in medicine as well as a degree in dentistry. So they're super brilliant qualified people. But a lot of dentists decide to just do some rotas in oral surgery for a few years, often when they are qualified, to gain the experience of taking out some of the more difficult extractions and things we have to do, and working under general anaesthetic and sedation in a hospital setting. I've mentioned orthodontics. You do need to do additional qualifications to be an orthodontist. A lot of people are very interested in that line of work. Pediatrics is another area that people are very interested in, treating lots of little people. That's, again, very different to treating adults because children are often really anxious. They're absolutely adorable to treat. And often if you're in practice, you'll know someone from when they were tiny right through, so you gain this great relationship with them. And it's lovely to see people growing up and that they trust you. And that's a lovely aspect of it. The other thing I would stress as well is we do a lot of preventative work. So we're almost, what Gareth was saying, there's always going to be a need for dentistry, but we spend our lives trying to prevent people from needing us. And we do a huge amount of promotion work. All dentists do this to try and get people's mouths healthy. So we're very, very keen on oral health. And what has been exciting within the profession in recent years is that dental nurses now are starting to get on board and often running their own clinics, promoting oral health as well, and getting involved and going out into community to do that as well. So that's really exciting. And oral health is starting, the importance of oral health within general medicine is starting to be recognised as well, that it impacts on our health when our mouths are really unhealthy or very unclean. So lots of strands to it, basically. I think I've covered everything I wanted to there.
Yeah, well, I'm sure people will have questions. They may have their own particular niche areas they want to find out a little bit more about. So if you're just joining us now, do make sure that you submit your own questions. So anything that you don't think I'm covering, that you want to find out, this is your opportunity now. You've got this direct interaction with Una, who is a real expert in careers in dentistry. So my next question is, what does an average day or week look like? So if I could get you just to think back in time, Una, to perhaps when you were that family dentist, which I suspect is the type of dentistry that would resonate with most people watching this at the moment. I mean, is it just sort of 9 to 5 of different customers coming in, and what does the average day look like? I mean, is there
Yeah.
paperwork to be doing as well? And
Yeah. No, there is, and there's a lot more than when I qualified as well. The note taking has become much more extensive. So usually you would come in good time in the morning to look through your diary. Very often you look through your diary the day before, and you know who's coming in, and you'll have discussed it with your nurse beforehand, so that you've got all the equipment. If you're using things that have been made in a laboratory, like crowns and bridges and things, or dentures, they are in place for you. So you usually check that before, because you want to come in the morning and sort of hit the ground running, and it's a busy, busy day. You are seeing people very quickly and doing very, as I said, very fine detailed work on them, while chatting to them and keeping them at their ease. And then there's that whole business side of it as well, because you do have to make sure you have enough people coming in, so that you can actually run your business. So there, as well as caring about the patients, you've also got to make sure that the business side of things work as well. So there's a lot of chatting about money with people, and making sure that everybody understands what's going on. But it's a satisfying day. If you like to be busy, it is a busy environment, but satisfying in that you're in there doing some really fine detailed work with your hands, while helping to get people often out of pain, which is it's the most enjoyable for me, the most enjoyable bit of it. So you might get somebody coming in as an emergency. You have to squeeze in, so you've got to be quite agile and able to adapt to circumstances often. Sometimes something that you start doing turns out to be really complicated, or and you end up working later, or having to rearrange your day around it. So great relationship with your nurse and with the other team that you're working with within the practice is incredibly important. Team working in medicine is so fantastically important, but with dentistry, that relationship you have with your nurse, and certainly the relationship you have with other colleagues, is incredibly important as well. So yeah.
Yeah, for sure. And like I can see there's a couple of questions coming in already, which is fantastic. So we will make sure that we ask all of those.
Yep.
Again, if there's a particular strand of dentistry that you want to find out about, or want to know what a day in the life would look like, ask Una that question. There's a good chance that if she doesn't know herself, she will be able to reflect on some of her peers' own anecdotes and experiences to be able to answer that. Look, I guess the question for you is, what are the challenging sides of dentistry that perhaps people wouldn't be aware of when they're 15, 16 years old and considering this as a career? Are there things that you perhaps wouldn't find out about until a little bit later on that you would like these people to know about now?
I think that physically it's quite hard. You are sitting a lot, and we take a great deal of care whenever you go into the dentist will make people lie down now. That's because dentists used to keep osteopaths in business with hurt backs, because they used to stand and lean over. So nowadays we take a great deal of care of our backs, and we're much more sensible and understand how to take care of ourselves. But it's still physically very tiring. And I would say emotionally it can be very draining. If you have someone coming in who is very frightened, and you're an empathetic person, which hopefully if you're going to get into a healthcare setting, you probably are, you're probably going to take a lot of that on. And that can be difficult. And this is where I come back to the teamwork is so important. Because if you have a great relationship with your colleagues, that you can chat about how you feel about these things, and then you have a great day. So I would say going into it expecting that you want to be part of a brilliant team is a really good way to go into dentistry, or indeed any aspect of medicine, I would say, because it's who we work with that is as important with it all. I guess the other thing I hadn't realized, because I hadn't really had much dentistry done myself, so I didn't know how difficult it was for people, and that when you do get things right, or they do start to trust you, how incredibly grateful people are. So it's very, very rewarding for that reason. If you make a difference for people, whether it's that you've got them out of pain, or you've made their smile look better, or they've just always never been able to cope at the dentist and suddenly they can cope when they come to see you, it's a great feeling. That's a good day driving home thinking, yeah, I did good today, that was good. So those are the really wonderful bits that I just don't think that you would anticipate, just the impact that you have, and how close you get to people. I mean, again, I had no idea that people came into I know people chat to their hairdressers, but people chat to dentists as well. I mean, they tell us all sorts of things. So you do get very close to people, particularly working as a family dentist who you know people for years and years and years. It's a very close relationship, and that's a very nice thing too.
Sure. Okay. Thank you. Really, really well answered. If I could move the conversation on, I suspect this will be the thing that a lot of people really want to know about today, and this is the routes into dentistry. Excuse the pun. I didn't realise I'd done that actually. So firstly, thinking about looking at the registrations, most people we have on this call, I think, are probably year 10s, year 11s, and maybe a couple of year 12s, or maybe a couple younger than that. So mainly people who are considering what they're going to do after their GCSEs. Are there any A-level subjects that students must have done to want to go into dentistry?
I mean, obviously, I'm going to put a caveat in that you need to check with UCAS and make sure that, certain universities will have certain stipulations, and that's the same for dentistry as it is for any subject. But having done the degree, I would say you absolutely have to do chemistry. Because the first year and a half, you do an incredible amount of biochemistry, and I don't think you could do it if you hadn't done chemistry. So I know when I was doing the degree, it was a stipulated subject, and I believe it still is, but not for all universities, and it would be a shame not to do it. Chemistry A level is very hard, but I think it just helps you so much then with the first year, and first year dental exams are very tough, so any help you can get is a good thing. Biology is a very helpful degree to have done as well, because you do a lot of the human biology in biology A level, which you will again cover. And then I know that universities like to see a breadth of interests. So a lot of younger colleagues have done some very interesting sort of third A levels then, and they've done drama or they've done art. So if there's something that you really love, and again, perhaps something that evidences you're good working with your hands, so maybe you're a great musician and you decide you're going to do music A level and you're a brilliant pianist, that will go down well with the university because they like those fine motor skills. So, if you're crafty, tell them about it. That's really important. It's as important as anything for dentistry that you are good with your hands.
Sure. Okay. Now we're thinking about doing the degrees to become a dentist. Is there a sort of a gateway dentistry undergraduate program that you go into, or can you choose to specialise in different areas in choosing your degree course?
No, it's a general dentistry degree, Bachelor of Dental Science, BDS is what we all have. So in order to be registered with the General Dental Council as a dentist in the UK, you have to have done a BDS, and it covers all aspects of dentistry. And then if you want to go on to specialize in something else, you would do that after you've done your BDS. So most BDSs courses will take 4.5 to 5 years. To do, and then at the end of that you do a year where you're getting paid, you're working, but you're a foundation dentist, so you're really doing a vocational trainee type role in a practice with a lot of support from the practice owner, and people are set up to mentor and to help and support in that way. It's been running for many years, and it's really, really good. It's very well supported.
Sure. Okay. And can you tell us a little bit more about that, that 4 or 5 year degree course? How's it broken down? Is it a very intensive 5 years?
Yes, it is. It is. The first year is non-patient facing, and you do, as I've already alluded to, a lot of biochemistry, physiology, and anatomy. So you're doing very much the same as the first year of medicine. And the idea is that dentists then have this really good, broad understanding of medicine. We're very lucky in a way to be very much considered on a par with doctors in terms of our knowledge and our experience. That's where it all starts in that first year. And then again, depending on the degree course, but in second year is when you start to see patients. And initially you will be doing a lot of work with what we call phantom heads, which is a really weird term actually, but it's just a sort of plastic head with teeth in it, and you practice doing all of the work on that, so that you don't get loose on a human being until you've actually demonstrated some skill. And you usually have a tutor who will support you and help you with that. And there's all the different aspects I've already alluded to, doing all the fillings and doing denture work and more complicated fillings and things. You start gradually doing more and more of them. Start off with the simple stuff, and then you start doing the more complex works then in third year and fourth year. We started seeing patients about Christmas time of my second year, I can still remember the face of my first ever patient. I can still remember going into university that day on the bus and being absolutely terrified that I was going to see this poor lady. And the first thing she said to me was, "Oh, the last dental student I saw got first in her year, and she's just finished. She's just qualified." And I was thinking, I'm not telling you that you're my first filling that I've ever done. And it took so long to do, and I think it would take me 5 minutes to do now. But I was so frightened of doing something wrong. I was being really, really cautious and careful. And I think that's a good sign. I would say all my colleagues were the same, and we got a lot of support. So yeah, it's dentistry is very, very well taught in the UK. So you will get a lot of support. And as I keep saying about being good with your hands, but so much of it is hands-on. If you enjoy that and enjoy that camaraderie, you'll have a great time. You know, you'll really enjoy it. And then if you enjoy taking teeth out, you start doing that later on in second year as well. And then they do let you lose some patients with that as well.
Sure. Okay. No, you've touched on this already, I think, but as well as the qualifications that are, of course, absolutely essential in the industry, but thinking about the skills and qualities that someone's got to have, and I think you mentioned it about the importance of being able to put patients at ease, and I think that's something I've only realised recently with my dentist, that he asked me lots of questions about how I am and what I've been up to and what I've been watching on the TV. I guess that's all just part of trying to reassure me and making me feel relaxed.
You
But
have
can you
to be a people person. Yeah, Gareth, you have to be a people person is what I would say. You have to really genuinely be interested in what you were doing with us, you know. So I think it comes to that. If you enjoy that interacting with people, if you enjoy putting people at their ease and giving them a good experience, those are the really important characteristics. I think it's incredibly important to be empathetic as well, and very understanding of where our patients are sitting in terms of their fears and anxieties about everything. But then you also have to be organized person. The note taking is incredibly important. You've got to be very organized in the way that you're thinking about diagnosing things. Some people come in and things are very complicated and it's difficult to work out how you're going to treatment plan them. I like that myself. I like complex treatment plans. So actually you've got to be quite a logical person and be able to pattern sort and look to come up with the best solution for someone. So there's definitely some interesting problem solving in dentistry as well, particularly in my field in special care, I would say. One of the reasons I like it.
And then you spoke about the importance of having really good fine motor skills, of being able to use your hands as well, which is
it's so important.
Really something I've ever considered. It's really important. Are there any sort of experiences or ways of developing those fine motor skills that you'd recommend people maybe ever think about now? I mean, I'm just thinking my children have got one of those machines where you've got the circle and you've got to try and around there. I mean, threading a needle, for instance, are those sorts of things useful?
Yeah, I think so, but then I would say if you like using your hands, you probably started doing that kind of thing when you were a kid. So if you were someone that loved using Lego, for example, and building up intricate things, or as I've already mentioned, maybe you played the piano or the violin, maybe you like doing crafty things like knitting or sewing or something, or making model aeroplanes. People who do that kind of thing often get very attracted to dentistry because it's the same kind of, I'm doing something, I'm making something with my hands. So you could develop fine motor skills, but most people come into it, I think, because they enjoy that side of life and they want to do it. And then they've got the skills because they've been doing it because they enjoy it, if that makes sense. So I think if you don't enjoy using your hands in that way, maybe another aspect of medicine might be a better choice for you than dentistry, because so much of it is that hands-on. I'm sure all the universities would completely agree with me. I know in the selection process, they'll often ask people that very question: what do you do? Do you use your hands? Tell us about what you do to sort of relax. And you know, if as I said, you're somebody who has already got some of those hobbies, then they'll usually think, yeah, that's a good sign if somebody's got that skill then.
Yeah, sure. That's really valuable. Another question we just have on this section is, I'm sure everyone watching this, if they're considering dentistry, would really love to go and do a traditional week's work experience with their dentist, which may or may not be possible. But are there any other experiences that people could gain that will give them a bit more of an insight into dentistry? I mean, I'm not for one moment saying start looking at your younger brother or sister's teeth and start trying to pull them around, but is there anything you'd recommend people do that might help?
Well, I know there are a lot of things on YouTube, but there are a lot of scary things on YouTube as well, which might put you off. But you could, I suppose, potentially look for some sort of live things on there. COVID has made everything incredibly difficult, and infection control is something we take very seriously in dentistry. Dentist surgeries are incredibly clean, always were, and since COVID we've had to be very, very careful, because when we use our drills, we create an aerosol spray, and that could potentially mean the virus could be quite strong in the room. That's the best way to put it. So we've had to put all sorts of extra precautions in place when you're at the dentist. And I think at the moment it would be very difficult for people, therefore, to go in and be able to observe in a way that they would have been able to before COVID. So that is so difficult for your generation. And I think really there is nothing like being able to go in and see what's actually like. But if you do have a good relationship with your dentist, I would suggest go and have a chat with them. You'll probably find they say very similar things to what I've been saying as well, but this is someone maybe you know, and they'll be very interested to hear, you know, what you're thinking about, and could give you some advice as well. They might even be able to show you around a little bit so you can see some of the equipment and different things like that. But actually observing patients at the moment, I think, is very difficult.
Sure. Okay. Right. Last couple of questions from me, and then I really want to crack on with the questions that have been submitted. And if you are watching this and you want to ask Una a question, something that hasn't been covered, or you want to clarify, please drop it in. Open up the questions tab on your dashboard, type in the message in there. It will come through to me, won't be visible to anyone else, and then we can make sure that you have the opportunity to have your questions answered. But again, we touched on this right at the start of the webinar, but I suspect there's an easy answer for this one, which is, do we know that there's going to be good future demand for dentists in the future?
Yes, is the answer. Dentistry is certainly changes, and at the moment we have a much more what we call a minimally invasive approach. So we try and take away as little tooth as possible, and the way that we do dentistry is a little bit different as a consequence. So I would certainly say in my career I've noticed a change. I think decay has, if anything, got worse, particularly for young kids. The main reason that children get admitted to hospital now is for dental general anesthetics, which is horrendous, and we're all trying to sort of reduce that. So there's always going to be a demand as well for helping people to clean their teeth, helping them with their gums and all of that as well. It might be at some point we get the nirvana we've all been looking for, which is something that a vaccine against dental decay, because we know it's caused by a particular bacteria, and we haven't been able to do it yet. But if we could do that, it would save an awful lot of pain and discomfort for people throughout the world. However, even if that happens, there'll still be things that will be needed. What is really exciting is that we think artificial intelligence will come into dentistry at some point. Remember, I keep saying we're doing very fine, detailed work. You really looking inside someone's mouth is a dark place. We have very good lights for it. Many of us, including myself, have a special light glasses called loupes, which help us to sort of magnify the area we're working on. But these are very, very small areas that we're working on. Teeth are tiny, if you think about it. And artificial intelligence could potentially do things to sort of, microscopic level. And I know in China now, they have placed some implants with artificial intelligence robots doing the work, which was very exciting to us in the profession. That was just before COVID happened. There were apparently 4 specialist dentists there to just make sure that the artificial intelligent robot knew what it was doing, but apparently did a very good job. So I could see AI coming into it, but I think certainly within all of our lifetimes, I am sure that it will still need human beings at the end of it and knowing what they're doing.
Sure. Okay, thank you. Well, I had a couple more questions, but I've just gone in and I've seen the range of questions so I just want to get through as many of these as we can.
Absolutely.
So I'm going to ask these as they come in. They're fantastic questions, so thank you for taking the time to submit these. So firstly, really good question, this one. Are there any jobs in dentistry that don't require looking in someone's mouth?
No, not many. And remember, if you did the degree, you really would have to do the looking in people's mouths first of all. But some people do go on to do epidemiology work, which is looking at data sets and looking at public health messaging, and you might work for NHS England to do that kind of work. So there is certainly that. Some people also get into the legal aspects of dentistry. Unfortunately, like in all medicine, things sometimes go wrong and patients try to sue dentists. And so there is a very strong legal side of things to support dentists, and often dentists themselves will go into doing that bit of it. So sometimes people decide to do that. But it's 5 years of your life doing the dental degree. So I would say you need to be prepared to look at mouths while you're doing the degree. That's a long time to then get
Sure.
to the end of it.
Yeah, okay, thank you. Now this one, what A-level grades do I need? Now, I guess you kind of answer that by saying, pay a lot of attention to the
Yeah,
particular
it'll be
university
high.
you want to go
It'll be
to.
very high. Yeah, it's incredibly well sought after. So usually A stars and A stars and A's. Brilliant personal statement helps. But I would say trying to think about some of those uh, particularly the slightly going lateral. So, have you done drama, for example? What have you done with that? Or, are you really good at languages or something? Just something to show a little bit of a difference about you. And that broad side of things is very important as well.
Sure, okay. Is dentistry related to maths in any way? So you spoke about chemistry being that predominant A-level subject, and then probably biology is a secondary one. What about maths?
Well, yes, in that people who are good at maths like problem solving immensely, because that's what maths is really, and also pattern recognition. So for medicine and dentistry, pattern recognition is probably the most important thing that you need, because you get given a huge amount of information and you have to diagnose and treat from all that information. And you wouldn't be able to do that if you didn't have that sort of logical brain that comes with doing maths. So maths is a great A level to do. If you're good at maths, certainly I would consider doing that, and I think that would be looked at very favorably because it indicates that aspect of you.
For sure. Okay. What is the most stressful part of your job? Well, I mean, yeah, tell us a little bit more about what you do on a day-to-day basis, Una.
Well, I'm the clinical director, which means that I run the service, and I have a team of about 48 people who help me to deliver care for some of the most vulnerable people in Hertfordshire that come in, and they on top of everything else they have to deal with, they also have problems with their teeth. So we run our clinics, we do a general anaesthetic service, we do a lot of sedation work. So a lot of what I do is making sure the team is okay. And I also do a lot of joining things up so that my patients and our patients in our service can get the very best care by being referred through various pathways in the NHS. So lots of meetings like that, which I absolutely love, doing that kind of thing, because that's a very holistic way of looking at provision of care. So this morning, for example, I had a long conversation with someone who's a restorative specialist, and we were talking about setting up a better pathway for people who've had cancer in their mouths, and how they struggle then to get access to dentistry sometimes in terms of what they need. They're struggling to eat because they've had a lot of surgery in their mouths, and it's just making things better for people so they can be seen more quickly. So a lot of what the kind of work I do is that kind of broad, big picture thinking. Because I'm a clinical director as well, I also am the an associate medical director of our service. So I attend board meetings and executive meetings and all sorts of things looking at general care within our trust as well. So yeah, I'm a little bit doing something slightly different than your average family high street dentist. But in terms of dentistry, my background is, as I've said, I worked in practice, but I'm passionate about sedation. I love doing very complicated sedations, trying to avoid general anesthetics for people. I've always worked with anxious people. Love working with people with quite severe anxiety and really helping them. And I also love doing really complicated root treatments. They're really difficult to do, and I absolutely love it. So a really difficult root treatment with sedation is my favorite thing. And I'm very happy, when I get to do that.
Okay. Could you go into more detail about orthodontics?
Yeah. So
Yeah.
orthodontics is the branch of dentistry which is about straightening teeth. I don't know if any of you have had your teeth straightened and been to see an orthodontist, but in order to do orthodontics, you have to do the main degree, the BDS, and then you do an additional qualification to do orthodontics. And it's actually incredibly competitive to get to be an orthodontist. So sometimes dentists will do different things. We've had a dentist, for example, who came and worked with us for 2 years because he wanted that on his CV, because he was hoping then that would mean it would be looked on a little bit more favorably for the orthodontics, because they like a very broad mix of skills for orthodontists as well. Yeah, so it's something that, again, you need incredibly good fine motor skills to do, but it's an interesting branch of dentistry. I really enjoyed it when I was doing it as my undergrad, but it's not something I have done myself. I certainly refer people to orthodontists and know some very well. Yeah, it's something that you would have to do as an additional qualification. Yeah.
Sure. Okay. Now this is where the question asks what your salary is, but I'm sure you're not going to reveal what your salary is, Una. But could you
No,
tell us what the
I'm not going to
average?
tell you. The
If we're
average
thinking about
salary.
the average salary, and what's the highest paid branch of dentistry?
Private dentistry is very well paid. And if you owned your own private practice or own several private practices, you would probably be earning well in excess of 150,000 a year, I would say. Um, Most dentists at the moment, I believe, high street dentists who do a mixture of private and NHS will be earning round about 100 to 120,000 pounds a year. Salaried dentists, which is uh, working in oral surgery, what we do, the sort of special care or pediatric dentist where you're salaried, isn't as much, but then you're salaried. So when you're in the high street, you're actually self-employed, you're running your own business. Every dentist who works as a family dentist does that. So that gives you means you don't get sick pay, you don't get holiday pay, but you do get, and you then have to pay your tax yourself. So it's a little bit, as I said, like running your own business. So sometimes dentists prefer to be salaried because they just don't need to worry about all of that, and they don't have to talk about money. They don't want to do the business side of things. They get into the salaried side of things. And typically your average dentist will start in the salary services on about 45,000, and it goes up to about, for an average dentist, it goes up to about 70,000. And then if you're more specialist than that, it's higher than that again.
Sure. Okay. Thank you. Another question, personal to you. What A-level grades did you get?
It was years ago. I got an A and two Bs, and at that point, that was more than you needed. I got an offer for two Bs and a C, but none of you are going to get offers for two Bs and a C for dentistry nowadays. We all laugh and say if we were doing A levels now, we'd never get on to do dentistry. But you're all amazing, the amazing grades that you all get nowadays.
Sure. Okay. Next two questions are kind of related, so I'm going to ask them both. So, is uni very hands-on, or is there a lot of note-taking? And then, are there exams in every year of uni, and are they hands-on practical exams, or are they written ones?
Okay, so those are very good questions. Uni's very hands-on, but not the first year. So first year is very much notes and lectures, and oh, you do get to do dissection, so for anatomy. So that's but it's not dealing with directly with the patient. And then I can't remember the next bit of the question now. Gareth, repeat it
The
to me again.
exams, are the exams practical exams?
Yes, both.
Both.
So
Okay.
yeah, so you do an exam at the end of first year, which is called your second BDS, and then you have a third BDS and a fourth BDS, and then you do your finals. The third and fourth BDS take place at some point during third and fourth year, and then at the end of usually the 4.5 years is when you do your final, and your final could be on anything you've learned in the 4 years. It's a really tough exam, and there's practical components. You're basically measured on and get a grade really for absolutely every bit of practical that you've done the whole way through the 4 years that you're doing practical work. So there'll be a log of, you do a filling and you kind of get a grade for it, and they want to see that you're improving, obviously, so that by the end of the degree you've got a real wealth of portfolio of what you're capable of, as well. And then they will sometimes we have to do a lot of case presentations, vivas. So you would go in at each of the exams and be asked questions. It's not just sitting and writing everything down. There's a lot of really difficult multiple choice questions which are negatively marked. This is the same in medicine as well. And I'll not lie to you, they're really hard. It's quite traumatic doing negatively marked multiple choice questions. If any of you do go on do dentistry and you start doing them, you think, oh yes, that dentist talked about that. We're all traumatized by it. But you get through it, because everyone's doing it at the end of the day. You get through it. If you can get through your
Yeah.
A levels, you can get through your degree. That's what
Sure,
I would
okay,
say.
that's a good way of looking at it. Now, the question is it a very competitive course? And you've said that it is. So,
It is.
what
It
can I
is.
do to stand out to unis?
I think I probably alluded to that again as well. It's very much about everyone is encouraged nowadays to do Duke of Edinburgh or to do volunteering, or maybe you've gone, I don't know, to Malawi or something like that. But and those are all wonderful things, and I wouldn't say don't do them. Please do, but be aware that a lot of other people are going to want to do the same thing as you. Will probably be thinking of that. So try and think a little bit out of the box, and particularly for dentistry, thinking about things that will demonstrate your fine motor skills will really stand you in good stead. Um, and be honest as well. If you're really passionate about art, talk about art and how much you love it, because then that will stand out. It's sometimes, I think, we all feel we have to be something we're not, but actually the most important thing you can do is bring you to the table if you get an interview for dentistry, and just be honest as to who you are. That will come through and they'll like that, because remember what I said, it's very much a people thing. So you've got to be able to chat to people, and you've got to be engaging, and empathetic, all these things. So it's important to be yourself. You can't demonstrate all of that if you're trying to pretend to be what you think the perfect dental student should be. Just be yourself. It's very
Okay,
important.
really, really good life advice there, I think, Una, as well as anything to do with the personal statement.
Yeah.
Question here, why dentistry and not medicine? So why might someone choose to specialise in dentistry as opposed to the more general medicine?
Um, I think, having obviously worked in and known so many dentists over the years, and it's a very good question because a lot of people do consider whether to do one or the other. I think it's the autonomy of running your own business and very much being in control of your own day in that way that is particularly prevalent in dentistry. I mean, you get that if you're a GP, I guess, as well, but people like being more hands-on. So if you are interested in that surgical aspect of things, you really fancy working in that way, then not, being on your own with your dental nurse and sort of just doing it and making a decision, I'm doing this, and then doing it. You don't get that very much in other aspects of medicine. So I think it will appeal if you're independent minded in that way and you like the idea of running your own business. I would definitely think it's more for you. Um, yeah, I think probably that. Medicine is very broad. Obviously, you so many different branches of medicine, and you can almost think of dentistry as a different branch of medicine, really. But I think they realized very early on, when they were, way back in the day, that there was so much to learn with dentistry that you couldn't do medicine and then spend all the time doing the dentistry as well. So that's where dentistry then became its own sort of entity. But we still see ourselves very much sitting within medicine as a separate branch of medicine.
Sure. Okay. Whilst I think about it, I should remind everyone, if you're watching this webinar, you may be interested to know that we recorded a webinar probably about 18 months ago now with a junior doctor at the Lister Hospital in Stevenage, a similar format to this. And a bit like this one, we had so many fantastic questions. We actually needed to record a separate session for an extra hour just to get through all
Gosh.
those questions. So I will
Oh,
share the link onto our HOP site where you can look at all the previous webinars that we've run, of which Careers in Medicine, it's actually a two-parter on there. So you may well want to have a look at that one as well. Next question, I'm going to rattle through. You're answering these questions so well, Una, and so concisely. I think we should be able to get through them, so thank you.
good, good.
Is a high grade in GCSE required?
Yes, I'm afraid. Yes. They will
Yeah.
often go on that. Yeah. So they do expect it, particularly showing some of the, they like you to be good at sciences and they like you to be good at maths. So you would need to be having good grades in those as well. But I mean, English is also very important. Yeah. It's so competitive nowadays, to get on to do the degree. I think, yeah, the high grades are important.
Yeah, of course. I guess in the immediate future as well, you need to make sure you get the right GCSEs that will give you access to the A levels that you want to
Yeah.
do as well, or the course that you do at college.
Yeah.
Um, do you run your own practice? How hard is it to set one up? I don't know if that's, do you specifically run your own practice, but you can answer that one for us. And how hard is it to set one up? I mean, I guess that requires a lot of business skills, doesn't it? And business
Yeah,
acumen.
it really does. No, I don't, because I actually run a whole service, which is a salaried service. So I effectively run 6 practices, really, if you think of it. So I'm not running a practice that you're thinking of as a family dentist. Is it difficult to set it up? No, actually, it's not. Normally, people will go in as an associate dentist and work for a principal, is what we call the person who owns the practice, and they then get paid. The way it works out, you still have to pay your taxes and everything, but you're an associate, so you don't own the practice as such. You just contribute to the running of the practice when you're there. A lot of associates then, when they've gained some more experience, will decide to buy their own practice. They often buy into the practice that they're working in at that time, or there may be practices that are up for sale because someone is retiring and they decide to go in and they have to put down a lot of money, but there's a very good industry set up to support people to do that. So a little bit like taking out a mortgage, really. And so no, it's remarkably well-oiled machine to get that. But absolutely, having a good sense of business, you'll learn along the way. I would say certainly when we did the degree, they probably didn't do enough chatting to us about business things. You had to sort of learn on the hoof, so to speak. But I think maybe nowadays they do a little bit more about it, but not maybe as much as
Yeah.
perhaps would be beneficial. But that side of it can be really rewarding as well, just that aspect of it.
Okay, and then just clarify for me. So once you've qualified and you've
Yeah.
finished university, do you automatically as a dentist go into the NHS first of all, or can you never be part of the NHS and go privately straight away?
I think you would have to do your foundation year in order to get a registration number.
Yeah.
It's a performer's number that you have. So you're registered with the General Dental Council, but then you need a performer's number to be able to get paid effectively. And to get a performer's number, you have to have done your year of foundation training. So that would be NHS related. Also, when you go into private dentistry, you need to be seriously skilled. People are paying a lot of money directly to you. And I'm not saying that NHS dentists aren't extremely skilled, but there is a little bit more wriggle room within NHS to be sort of learning and honing your skills. With private work, people do expect an awful lot from you. So it'd be very, very hard to go straight from dental school into private. Private tends to be something you do a few years down the line when you've gained that bit more experience. Experiences, you can learn loads of things at dental school, but it isn't until you're really out there. I don't know if any of you are old enough to be driving, but it's a little bit like getting your license for driving, and then it isn't until you've been driving for a year or two that you really feel confident that you're a very, very skilled driver. You know what you're doing, but you haven't had all those experiences. Yeah, it makes a big difference.
For sure. Okay, it's a lovely personal question that's come in. What inspired you to become a dentist?
Oh, that's a good question. I'm a bit of a funny one, really. I was thinking of medicine, so that's why that question really resonated with me. I had actually thought about doing psychiatry. I was very interested in that and had done science A levels for that very reason, even though probably my favorite subjects were history and French. And my sister is a GP now, but she was doing medicine and she's older than me. And her first year exams were so awful. And I thought, oh, I really don't think I can face that, and it's just going to be so much. And I did loads of music. I'm a singer and have done play the piano a lot and things like that as well. So I was very into classical music, and I thought I'll never have time to do any of that, and really had a complete change of heart, and was left doing science A level, thinking, what am I going to do? Anyway, I decided to do dentistry because I do like working with my hands, and my sister was saying to me as well, and I hadn't mentioned this, but it is very true. The dental schools are quite small numbers, so they don't take on that many people because it's incredibly expensive to train us all up. And as a consequence, you do get very, very close to everybody in your year group because you're. Oh yes, I mean, Gareth, you asked me that about the average day. It is an intensive degree course. When you start seeing patients, you're expected to be in from 9 to 5 every day at university, and usually dressed not quite in the kind of ragged studenty look that everybody else is. So you feel a little bit, everybody else is, doing a few hours here and there, and they're going to the student union, and you're like back into clinic. So it is quite intense for that reason. Yeah, I think that was one of the things my sister said to me. The dental team are really close knit, and I liked that idea, and that is certainly very true. That you get that camaraderie from your colleagues. Yeah.
Yeah. Okay, yeah, thanks. Really good question. Another really good, more holistic question here. Well, you spoke about AI earlier. So this question is AI technology used a lot in cosmetic dentistry?
It isn't really yet. This is very much early days, and I would say within the next 10 to 15 years, we're expecting it to be used much more. We do, however, use things like scanners now, which are amazing, and they show fantastic 3D replications of what people's mouths look like. So in private dentistry, that's used a lot. So there's a lot, yeah, there's lots of gadgets, and I'm really glad you asked this question because I forgot to say it. People who like gadgets like dentistry, there's loads. It's really good for that. Yeah.
Yeah. Okay. Right. I can see the bottom of my screen now. So that means we are getting towards the end of the questions, but there's so many great ones that have come in today. In dentistry, does everyone just get a BDS, or are there levels to the BDS, e.g., first honours or 2-1 honours?
Well, when I did my degree, there wasn't. You could get a distinction if you did very well in certain subjects in your finals, but no, it's just a pass is the basic thing. But interestingly, I have seen in recent years some applications coming through from dentists where they have said whether they've got a 2-1, which really surprised me because previous to this, we're same as medicine. We just have distinction if you've managed to be very distinctively good in whatever aspect of it. I think that's probably still broadly the case across the patch.
Yeah. Okay. Do a few more questions about pay and salaries here. Do
All right.
associate dentists still make relatively higher salaries than public dentists?
Public dentists.
Yeah,
Do they mean salaried dentists?
I'm assuming so, but if you want
Assuming
to
so.
clarify
Yeah.
that question, then yeah.
Yeah. Yes. Yes, practice earns more. And the reason you earn more is because there's a recognition there that you're self-employed. And as I've already mentioned, you don't have the luxury then of sick pay, of holiday pay, pension, things. You have to sort it all out yourself. You're incredibly independent. So that's great because it gives you that independence, but you don't have that security net there. And I think the expectation, therefore, is you're paid very well and you need to be putting some aside and squirreling some aside in case something did happen to you and you needed that support. So, yes, all practice dentists will earn more than salary dentists will.
Okay. And then,
Depending on the level of experience of the salary dentist.
of
I'm not
course,
saying an associate dentist will start in as much pay as a high salary dentist, but it is generally in comparison to your peer group, you'd be paid more.
for sure. And then, is it tough for a principal dentist to allow you to join their private dental practice? I mean, how does that work? I mean, there must be all sorts of networking, I guess, and between different dentists. And
Yeah,
so, how do you
but
get
it's the
invited
same
to
as
be
any
part?
job. Well, they will advertise. So the same as any job, really. They advertise you often in the there's a journal called we have an association called the British Dental Association, and its journal is the BDJ, the British Dental Journal, and there's a big section of advertisements at the back of that. So people might want someone to join. They'll put the advert out, and then they will interview, and they will expect you to show a portfolio of all the work that you've done. And if they are a dentist who's particularly interested in some aspect of something, maybe it is cosmetic or maybe the root treatments bit, which is called endodontics, then they will say that, and you'll know if you're a good fit for them. So it's done pretty much the same as any job, really, in terms of interviewing and that as well.
Sure. Okay. There's a few more questions there, which I can summarise probably into one because they're a bit more around pay. So my question is, you spoke.
Right.
It's obviously a popular theme, and of course that
Yeah,
is a
no,
important
dentists are paid
consideration
well.
when,
We are paid
yeah.
well. So,
So,
yes. And one thing I
um,
didn't mention, though, as well as we are paid well, it's a public perception that we are, and it's true. Um, but there is also that thing that people don't really like dentists because they're quite scared of us. So even though you build up a great rapport with your patients, the amount of times that I honestly, if I had a pound for every time someone had said, "I hate dentists," no offense, I always say we're on a par with estate agents and traffic wardens, I think, in terms of being loved by the general public. But they love us when they're in pain, so that we can get them out of pain as well, is what I would say. I'm joking,
yeah.
obviously, but it is
No.
funny. There's
Yeah.
a truth in there, I think, as well.
Sure. Okay. So look, it's a well-paid occupation, but I mean,
It's extremely well paid.
presumably, yeah, I mean, presumably, as within any care profession, your motivations when you go into dentistry aren't really about the salary, are they? They'll be around caring
Some
for people.
people,
Is that?
I think some people do like that. Certainly in every cohort of dental students, I imagine there's a good number that have gone into it because they want to run their own business and they like the financial sort of security of knowing that dentistry is very well paid. It's very easy to get employment. There are never enough dentists in the UK, so you're not going to be sitting around looking for work. You will get work, and that's a great thing. And
Yeah,
the security of knowing you can go and earn quite a lot of money for your on an hourly rate is fantastic. But I would always say far more important is to really hone in on gaining great skills, being brilliant clinically, really getting so good at what you do so that you can deliver fantastic care for people and really help everybody is more rewarding. And then the money is the extra bonus. I think that's probably a better way to go into any healthcare profession in that
yeah,
way, because you'll enjoy it more, I would say, as well.
sure. Okay. And then, I mean, the work-life balance is. Do you find
Yeah.
yourself, are you going to likely to be in surgery or in your office all day and all night and at weekends, or is there plenty of
No,
is there good
no,
work-life
it's
balance?
good. It's good. It's one of the better ones for that. Because we run
Yeah.
a diary system, you can turn up when you want to work. You can work part-time, therefore, and get very, very well paid for your part-time work and just go home at the end of the day. You don't have to take it home with you. You don't have to do extra work. So a lot of the other professions aren't as kind in that way. Certainly don't think medicine is. I certainly don't think law is. Dentistry is great for that, and it gives you a great deal of flexibility there with the work-life balance. But it's a very stressful job, and I probably haven't said that enough. It is, and I think part of that is because it's busy, busy, busy. It's sometimes too hard to even get a breath. You're really working hard, really fast, doing really difficult work on someone who's very anxious. And you can't help taking that on board. So sometimes at the end of the day, you'll be emotionally very drained and you've got to go in the next day and do it again. So it is stressful and acknowledged to be one of the most stressful jobs as well. So it's another reason why we get paid what we get paid, I
Sure.
think. That's
Yeah.
the difficult side of it. Yeah.
That makes sense. Sure. There's one more question that's come in, and it's
Good,
tickled me a
because I
little bit.
wouldn't want to end on that one.
No,
That
no, no.
sounded too negative.
So I'm going to ask you the question, and that's going
Yeah.
to be all the time we're going to have for any questions. So, but really, there's been a tremendous amount. I would say of all the webinars we've done, proportionate to the number of people on the webinar, this has been the highest one. So, can you give yourself a filling? Or can you personally, Una, give
Brilliant.
yourself a filling?
No. Well, no. No. Saying that, I will always check my own teeth. I mean, I can do things like that and I know what I'm looking for. But no, you can't, because we learn to use mirrors when we're working as well. So you're kind of, put the little mirror in the mouth and you can kind of use that. And so you get quite ambidextrous, but you cannot get into your own mouth and be able to see what you're doing. You just can't. And so it wouldn't be safe. So unfortunately not,
Okay.
even if
Okay.
it was just a little front one. But most dentists will clean their own teeth. You come in and they've got the scaler out and they're cleaning their teeth. They'll do that. Yeah,
Sure. Okay. Okay.
yeah.
That's interesting.
That was a
Right.
funny
I
one.
just want to. I just want to finish on a slide. And first of all, to do that, I need to get up and move around. Yeah, don't worry, I'm still here. The room I'm in, it's got a light sensor, so if I don't move anywhere for a while, it goes off, and
Mm.
then I have to wave my hands. Anyway, we're nearly closing now. Before we close, for those of you that are still watching us live, you submitted some really, really fantastic questions. I'm not looking for any more questions, but I would appreciate if you could just type in the text box what's been useful for you, or what you've gained out of this last hour with Una. That would be really, really useful for us, just as a bit of feedback. So if I give you a moment or so just to type those in there. As you're doing that, on the screen at the moment, I've put up details of 3 websites, which hopefully Una will just explain to us a little bit about. And the QR codes underneath them should take you directly into the careers page of them. But these are websites that you may want to go and have a look at that will give you some good additional information on there. So do you want to tell us a little bit about the ones that we can see on the screen at the moment?
Yeah, probably the most important one to look at is the BDA, which I've already mentioned. So that is effectively the dentist union. If you want to think of it, they're there to support us, and they have a fantastic amount of information on there. And I would definitely suggest you look there as well. There's various colleges of dentistry. The best one, if you're interested in being a family dentist, is called the FGDP. So you'll all have heard of GPs, but we are GDPs, General Dental Practitioners, and the Federation of General Dental Practitioners is another one that is part of one of the colleges of general dentistry that is particularly good. And step into the NHS. I mean, I work for the NHS. I'm proud to do so. I have been a private dentist for very many years when I was doing all my root treatment work in the past, and that was very rewarding too. But there is something wonderful about working in the NHS. It is a fantastic organisation. So I would definitely look into that. If you're interested in medicine, you're going to inevitably end up connected to it in some way.
Sure. Okay. Thank you very much. We had some really nice feedback come through as well, which is almost is directed squarely at you, Una. So thank you so much for,
Oh,
for all
lovely.
the
I'd quite
wisdom that
like to
you.
see it if that was possible. So
Yeah.
you may
No. Absolutely.
send
No.
it
No.
my
No.
way, Gareth. That would be
I
nice. Thank
can.
you, everybody.
I can share that with you. I just realised there that in sharing your wisdom, I've given, of course, another terrible dentistry pun, but I'm sure you're used to that sort of thing by now.
All right.
And finally, just in closing, just want, for those of you watching at the moment, have a look at our HOP website. The QR code there will take you directly through to the library of webinars that we've recorded over the last 18 months or so. I'm thinking the ones that would be most relevant for you might be careers in medicine, which was a two-parter. We've also done a couple of other medical related. You may find there are other ones on there. You may find there are ones that your friends and family are interested in particular types of careers. So do have a look at those. They're all in the same format to this one. So if you found this one useful, good chance someone will find another one of them useful as well. Thank you for those of you, particularly those of you who watched this session live and have contributed this with some fabulous questions today. Really, really touched by the range of questions that come in. But of course, first and foremost, thank you so much to Una for giving up her time and for sharing her knowledge and experience with you about careers in dentistry. So really, really appreciate that, Una. It's been a pleasure to have you on with us this afternoon.
Okay. Thanks, everybody.
Thanks very much, and the best of luck to all of you in your future careers and the steps that you take. And hopefully, maybe a few of you we'll see you popping up in dental surgeries around Hertfordshire in the not too distant future. Thanks ever so much. Enjoy your evenings.